Thank you for joining us for this session, Sexuality and Intimacy After Cancer. Sexual health and intimacy are important aspects in life, yet it is a topic that many don't discuss with their medical teams or partners. Jillian Bissar, a social work supervisor at MD Anderson Cancer Center, who specializes in this topic, will offer a direct and honest discussion around intimacy after gynecologic cancer. She will provide strategies and helpful hints to help you regain your sexual self. I'll turn it over now to you, Jillian.
Hello and welcome. My name is Jillian Bissar, and I am a social worker in Houston, Texas. Today, we're going to be talking about sexuality and intimacy after cancer. As we move through this presentation, please be sure to take care of yourself. Some topics may feel new or uncomfortable, and others may be triggering. You need to discern for yourself if it is good for you to lean in a bit to that discomfort in order to grow, or if you need to step away and to address your needs in a different way today, perhaps with a professional one-on-one or in a safer space. These are the topics we're going to move through today. Before we start, I would just like you to know that I receive no benefit for recommending any certain books, techniques, or tools, or any other resources. I have no financial gain from this presentation. And the tools that I do endorse, I do so because I've found them to be beneficial to my work. Endorsement of one tool from a body of work does not necessarily mean that I am familiar with or endorse the entirety of that body of work. While I work for MD Anderson in the Texas Medical Center, the information endorsed here is a mix of my oncological professional experience and my private practice experience. The professional advice given is my own and for educational purposes. The first step in our journey is to take a step back and assess the situation. Where are you right now with your sexual self? What do you want? What do you need to get there? How will we know when we get to the point that you want to be? Taking this first step can be scary. You may have already thought about it some. I would like you to think about it as an opportunity to look at things differently. I want to start with our guiding principle, and that is that every body is a sexual being from birth to death at an age-appropriate and stage-appropriate level. From there, we can extrapolate that everybody deserves pleasure and positive sexual experiences, again, at an age and stage-appropriate level. In our early years, this may include learning the proper names for our body parts, how they work, and that we have a right to decide who has access to our body, when, and under what circumstances. For some of us, our struggles with our bodies and our sexual selves, consent and body autonomy, may have started here. As we learn today, and maybe sometime after, take some time to reflect on the questions we have posed here so that you become more clear on where you are at and what you want. Sexuality encompasses nearly every aspect of our being, from attitudes and values to feelings and experiences. It influences us on the individual level, the family level. We're influenced by culture, religion, spirituality, laws, professions, institutions, science, and politics. As we age and grow, no matter who we are, our bodies will change. Everyone has bodily changes to deal with, from big to small, over their lifetime. What we do know is that each of us as we live our lives, things will happen. And as these things happen, we have the opportunity to change and grow and adjust with our bodies. This is not to say that there aren't some bigger hurdles to get over in situations like cancer, its diagnosis, and treatments. Many of us are taught to think very narrowly about what sex is and what it is not. One of the biggest tools we can use as we grow and change and adjust is to learn that over time, as our bodies change, that we have the ability to think outside the box. Pictured here, you'll see the circles of sexuality. I show these because they show different areas in which we can explore and think outside the box. We can look at these, and on our journey and reflection, we can look to see what areas we may need some healing in, what areas we may need to grieve, loss, and areas maybe that we like to explore further. The WHO says sexuality is a big part of living a fulfilled life. So our journey today is going to help you walk through some tools and some exercises that you may be able to use to help make sure that your sexual life is as fulfilling as it can be. Assessing the situation is the process of setting your own mind right to utilize the tools and practical options that can assist in embracing sexuality and intimacy after cancer. For some, this can be done alone with some of the tools for guidance. For others, this may require professional assistance from a therapist who is trained in sexual health, cancer, and/or chronic illness. Not every therapist is trained to provide the needed supports that a person who has dealt with cancer needs. So it is important to look at their credentialing and area of expertise. Some of the tools here that we talk about today may be helpful in exploring this on your own. We'll talk about this a bit later, but a book by Emily Nagoski titled Come As You Are is a wonderful resource and comes with a workbook, plus a too long didn't read section to share with your pals. These are just some examples of some questions that we may want to explore in our journey together. Some people need to figure out where they're at and assess maybe some past trauma that they've had before they continue on their journey. Are there beliefs from before or after your diagnosis that are currently compounding the situation you're in and can maybe contributing to a sex life that you don't find fulfilling? Are there existing confining and negative ideas about sex and relationship? Perhaps these come from culture, religion, or education. Maybe a past personal experience that was negative. And again, we need to look, do you have trauma experiences? And this may include cancer and its treatments that need to be assessed. I suggest that you attend to these first before going further in your journey. Cancer can have many impacts on your sexual self and your body. Fertility, body image, your own identity, your own autonomy, or a shift in your role in your family or even in society. Your energy, the function of your body, and it can contribute to depression and anxiety. These are just some examples of cancer's impacts. You, in your journey and you're thinking through this, may come up with some that are personal for you. One of the steps in this journey is to grieve your losses. Many times we can get stuck when we've had a loss and we haven't appropriately addressed that this loss has happened. You might feel a little silly doing this, but having some sort of ritual around the grieving process is important, just as when we lose a loved one to physical death. It is important to have a ritual around the loss of any of these things that come along, perhaps with cancer treatment. These may have been downplayed in your journey with your medical professionals. They may not have been appropriately addressed. They may be downplayed by friends and family. At least you have your life, they might say. It is important that we don't get stuck in toxic positivity and only looking at the things that we've gained by going through treatment. Take the time to create space to grieve these losses. These are just a few examples on the slide. You may have some that are specific to you. It's important that you have time to take stock of this, perhaps write it down. Maybe you need some support in this through professional counseling or with a very good friend who understands and can hold space for you. Either way, I really encourage you to take the time to grieve these losses. This may be a process. This is not going to be a quick thing, but at least attending to it will help you move along in your journey. Once we've done some work around that, I would encourage everyone to think about this as an opportunity to redesign. You can focus on systems, your relationship with yourself. What do you want that to look like now? Was it what you wanted it to be prior to cancer? Is it what you want it to be now? What does that look like? You can also focus on a couple or even friend system. Other opportunities are opportunities for your body to have some work done, some retraining, some physical therapy, some rehabilitation. There are many tools and professionals who can help you with this, and we'll talk about those in our toolbox coming up. But it's an opportunity to retrain your body. It's an opportunity to get in touch with your body. Sometimes when we have a physical trauma like surgery or a diagnosis where we feel maybe our body has betrayed us, we may have tuned out of our body because it is too painful to be tuned in. At some point along that journey, it may be safe to tune back in and to lean into that. Things that can help us often can be medications, perhaps sexual aids such as toys, and other tools that we'll talk about in a little bit. But again, I want you to think about this as a redesign or a re-scripting of you, as you will, of what you want and reconnection with those systems that are your intimate relationships and your body. As always, I include an opportunity to address safety. Whenever we're talking about sexual health, I want to make sure that people know that they need to take care of themselves in a lot of different ways. One, you may need to use barrier protection depending on what kind of treatments you've had for certain periods of time, and that's a discussion that you can have with your medical professionals. Those barrier protections can protect against contamination with chemo or radiation. They can also protect against sexually transmitted infections and pregnancies that we are not wanting. I want to make sure that we don't assume that a diagnosis of infertility means a free pass to have unprotected sex. There's lots of reasons why protected sexual intercourse is beneficial. And safety and consent are sexy. What can happen often is that we get stuck in this fear cycle. So you'll see the spiral on the left. There's fear and concern around many things, maybe pain, discomfort, disfigurement, scarring. There might be assumptions about what you want, what a partner wants. A partner may pick up on this fear. The partner may be withdrawing affection or intimacy because they want to respect your boundaries. And then the fear is realized. This is an opportunity for rescripting. So if you look at the pyramid here, at the base, we're maintaining sexual intimacy as an essential part of our recovery. I'm going to give you some tools for maintaining that intimacy. Then we're going to address functions and feelings. And then we are going to engage in intentional sex. Part of maintaining those intimacy and being intentional around intimacy is having these meta conversations about how you want to re-enter your relationship post-cancer diagnosis. So here are some tools you can use. John Gottman has some really great tools that you can look into. He has books that you can read and you can work on with partners. One really fabulous tool is the State of the Union meeting. This helps to reduce any conflicts, talk through them. It also helps to create space where you're having an intimate moment. You're being vulnerable, you're talking, you're creating some of that mental intimacy. So the suggestion is to pick a day and time each week to hold the meeting. You talk about what's going well. You offer 5 appreciations each. And then you discuss a conflict, maybe a process or a recent argument, something that's not going so well. And then you ask each other, what would make you feel loved this week? This simple practice can help maintain intimacy throughout your cancer journey. Maybe when physical intimacy is limited or maybe not on the table. Another way to encourage this mental intimacy is to understand love languages. And this may come into play a lot with caregiving. As roles and relationships change, it may have been fine for people to go about doing what they do and you could take care of yourself. But it's important to have these meta conversations around what really works for you in caregiving. How do you feel loved and cared for? And it's important to understand that of any of your partners. These are the 5 love languages: words of affirmation, acts of service, quality time, giving gifts, and physical touch. Understanding these can help you understand how to better interact with your partners. Many times people operate out of the one that they want for themselves. So they think they're providing a lot of love to their loved one because, let's say, their love language is acts of service. So they're getting the groceries and doing the dishes and mowing the lawn and taking care of all the things. However, if their partner's love language is quality time, doing all the things might be taking away from quality time. And so one partner may say, I'm doing all the acts of service, I'm loving you, I'm loving you. And the other partner is thinking, I don't feel loved. I mean, those are nice. It's lovely. Thank you for taking care of them. But I'd really like to sit down and watch a movie with you, or have a picnic, or just snuggle, whatever it might be. The quality time is what's going to hit the right spot there. And so it's really important to have these conversations around what is your love language and what kinds of things would you like in that category to help grow and sustain that intimacy through the whole process and ongoing. Another part of being intentional. So here are some books that you can read and reference. I already referenced Come As You Are by Emily Nagoski. The wonderful thing about this is it has the workbook, so you can work through it by yourself or together with a partner. If your partner's not one for reading, again, it has the too long didn't read synopsis, and it has the workbook for you to actually fill out and do the work on your own. If you want to read more and get more into the 5 love languages, there's the book by Gary Chapman. You can look at John Gottman's work. One of his books is the 7 Principles for Making Marriage Work. You could say this is the 7 Principles for Making Relationships Work. It doesn't necessarily have to be marriage. And it has a lot of additional tools in there, in addition to the State of the Union address. The 4 Agreements is a really good one. It's a nice foray into being intentional with all sorts of relationships, not just your romantic ones. The Ultimate Guide to Sex and Disability is really helpful, and so is Assisted Loving if you've had some major physical changes, if you don't quite have the same kind of mobility. And some of this can come along with just natural aging, or of course, the process of being treated for cancer. Other books that are really great are The State of Affairs and Mating in Captivity by Esther Perel. And if you're not a reader, or even if you are, there's a short series on Netflix that I really love called The Principles of Pleasure. It is vulva owner focused and very sex positive, very science-based, but very easy to understand. And it has a lot of wonderful suggestions. It's something you can stick on. You could even, if quality time is one of your love languages, you could get your partner to sit down with you and watch it. So now we're looking at intentional sex. This is where we think outside the box, okay? Sex is not just one thing, although we really tend to think of it when we say sex, we then tend to think of intercourse, penis and vagina, very narrow. That's usually the first thing that comes up for people. However, everything is on the table. All of it is sex. All of it is under the umbrella. And I want you to think away from the idea of foreplay as an appetizer. All of that is included. And for many people who are vulva owners, even pre a cancer diagnosis and treatment, non-penetrative sex is the way to go. So this can be clitoral stimulation. This can be maybe fingering, petting on the outside, or maybe just at the precipice of the vaginal canal. Many things we can think about here. We want to make sure we're incorporating a lot of patience. We want to create time, space, and be intentional. Slow things down and be very present. That's why in the beginning we had to do the work on where we're at mentally, because in order to slow things down and be present, we need to be in a space mentally to do that. Work on communication. So some of those tools we talked about with some of those books earlier, some of those exercises can help you build that foundation of that mental intimacy to build that communication. We're focusing on experience and not outcome. I want you to think about the experience for you, not goal-directed sexual experiences or performance. We're not thinking about those things. We're just in the moment, experiencing what we're experiencing. And we want to be creative. Try new things. See what works for you. As our bodies grow and change over time, no matter what or who we are, different things are going to work for us at different points in our lives. And so, again, this is an opportunity to re-script what's going to work for you. And you may need to be directive with your partners. You can do this better when you've done some self-exploration. So I'm going to encourage you to self-pleasure or to masturbate, to learn more about what you like. For some of you, this won't be an issue, and you've done it before and you're happy to explore. For some of you, this may be new. This may feel a little uncomfortable. This is a point at which you decide if you want to lean in and try a little more for some growth. And you can start slow and be very intentional about it to discover what works for your body. We're going to look at some anatomy later that can help you with this process. Here are some tools that I've found work for people better. Now, as we know, vaginal dryness can be a thing that comes with cancer and treatment and changing of hormones, and it can come with time, in your lifetime anyway. It's on the normal spectrum. So let's embrace utilization of lube. Uber Lube is a really great lube. It's not full of all harmful additives. It's got a good consistency, so it's going to last a little bit longer. So that's one that you can look into. There are many others. And so if you want to explore some others, maybe that are more readily available to you, I do encourage visiting a sex shop. I encourage visiting a sex shop that probably prides itself on being vulva owner focused and inclusive. Oftentimes those are going to be places where you can get some support around what tools and lubricants and things may work best for your needs. Another really great tool that you can use if penetration is often painful and you maybe need to make it less deep. The O-Nut is a buffer ring set. It comes with 4 buffer rings, and you can customize to the length that you need that a penis owning partner can utilize so that you reduce the depth of penetration. If you have perhaps some scar tissue or, we've had surgery, those kinds of things, pelvic floor physical therapy can be very, very useful. They may recommend dilators. They may recommend scar tissue massage to address any adhesions. So anytime we have abdominal surgery, there may be adhesions that we need to address. You could also utilize a sexological body worker. So you can find one in your area. They're not available everywhere, but if you could find one in your area at sexologicalbodywork.org. In some areas, surrogate partner therapy is available. So this is where you work with someone who is a sexual surrogate. This is not legally protected in every state, but it is readily available in most states. It is not against the law, but it is more protected in some states than others. So you work with the sexual surrogate, and then you work with a therapist to address any needs. You can use techniques like body show and tell. That's where you stop. And before you ever engage in any physical touch, you talk about each other's bodies. I'm a little bald here. I have wrinkles here. I have scars or tattoos. These are the things that remind us that the past is real, and it's leaning in. It's getting comfortable with your body, because everybody, no matter what state it's in, deserves pleasure and deserves physical touch that works for them. And you can also do body mapping. So that's touch to build intimacy. There's no rush. It's goal-free. It's all about experience and sensation, touching different parts, seeing how that feels, touching them in different ways, circles, flicking, light touch, harder touch, cold, hot, different things to figure out where and what works, where and what feels good now. And of course, with hormonal changes, sometimes our ability to be aroused is affected. And so we may want to explore ways that we can safely improve arousal. And for some people, that may be pornography. I encourage you that if you're going to engage with that, which is wonderfully fine, it is fantasy, it is not instruction. It is for stimulation purposes, but there are providers like Erica Lust who are ethical pornography providers. And I encourage you that if we're going to engage in ethical pornography, which is what we want to do, if that's the choice that we make, that we pay for our pornography. So that way we know that we're supporting someone who is providing this entertainment for us, and it is not encouraging any of the downsides of pornography that we've heard about. So that's all an option for you to help get where you want to be. And of course, there's general health and nutrition. So you want to work with perhaps a dietitian or a nutritionist and your medical professionals to make sure that your body is getting what it needs to fuel it post-cancer treatment, so that it's in the best shape and performance it can be for who you are and where you're at. And all of this will feed into the rest of your sexual self and getting to where you want to be in your journey. I really want to take time to acknowledge that sex is for pleasure. Often when we're taught about sex, it's couched in only reproductive purposes, but sex is for pleasure. We are humans and we have sex for pleasure. As a culture, we do not acknowledge this enough. We have a lot of shame around this idea, and I want to encourage you to work to unload some of that shame. And there seems to be more of it around people who are vulva owners. So we may have an increased hurdle there for our audience here today. This is not typically centered, like I said, in the discussion around sex and sexual health, and it should be. Sex is for pleasure. Its sole purpose is not for procreation. Its purpose is for pleasure. It is a wonderful coping tool. And again, I'm talking sex in the broad umbrella of sex. So all of the things that are sexual activities are on the table, because your body, everybody deserves safe, consensual, pleasurable touch and experiences. So before, when I talked about it may be helpful to lean into doing some self-pleasuring and to masturbate, to learn, to relearn, to remap your own body so that you can advocate for what you need in a sexual encounter. It's really important for you to know that these are analogous structures here. So we have on the left, the clitoris, and on the right, the penis and all of its parts. They are analogous. We have the same parts, just in different shapes and sizes. One is more external, one is more internal. The amazing thing to me is that mainstream science had not acknowledged the full anatomy of the clitoris until 1999. I'll let that sink in. 1999. Changes to anatomy text and the study of female anatomy is just now taking place. The first medical textbooks to include the full clitoris model are just now being published. So this would be akin to all of our lives if we had penises, being told that our penis was only the very tip, the glans, and the rest of it didn't matter. The rest of it didn't exist. So I want you to really embrace that you have a lot more to work with than you think you do, and it's all internal. And And this is where that body mapping and getting to know yourself can be very, very important. So there may be parts that really work for you that have nothing to do with the glands of the clitoris. Lean into that. Explore it. Knowledge is power, and now you know you have a lot more to work with. On the right, we have the sexual response cycle. I think this is just helpful for people to know that we have excitement, we have plateau, we reach orgasm, and then we have resolution. There may be issues caused by hormonal changes and other things that maybe elongate parts of this cycle or truncate parts of this cycle. Again, I don't want people to get stuck in goal-directed sex. And by that, I mean get stuck in the idea of having an orgasm. What we're looking at is intimate and pleasurable touch. And people can have orgasms through other mechanisms. There are people who can have orgasms through nipple stimulation. I want you to really embrace that there are different ways to get where you want to go, and that it's not always about orgasms. We want to make sure that we're embracing all sorts of meaningful, pleasurable touch in this journey. If you're on Instagram, I suggest that you follow the cancer patient. This is a young adult who has a lot of really apt things to say about their cancer journey. And so you may find a lot of solidarity in their posts. But one thing that they have coined is the post-cancer hoe phase. And what I want to do in highlighting this here is that sex is life-affirming. When we've gone through a process like cancer, diagnosis, treatment, all of that, we want to feel alive in a lot of ways. And so I want you to really embrace that sex is and can be life-affirming. Due to your own journey, it may not always feel like that. And so that's why we talked about working on yourself, getting your mind right for this journey, and for re-entering and re-scripting your sexual life. So again, we want to address any traumas we've had. We want to address and grieve any losses that we've had. But we want to remember that sex can be very life-affirming. It is a wonderful coping mechanism, and that everybody deserves pleasurable, consensual touch and experiences. So once we've done this work and we've thought about, what we need, and we've thought about what we may need to address and how we'd like to address it, perhaps, we want to choose the path forward. Again, we're going to think outside the box. We're not going to stay narrow with sex and intimacy. We're going to try new things. We're going to work with our medical professionals. We're going to work with physical therapists. We're going to work with sexological body workers to address physical barriers. And we're going to work with therapists and ourselves, maybe workbooks, to address any of the psychological barriers. We're going to do our own discernment to re-script the how. How do we engage? Who do we want to engage with? What feels good now? What acts or movements or touch or whatever is on the table for us? What would we like to explore? And we will ease into it. We will embrace new things, and we're going to lean into our vulnerability, some Brene Brown here that you may want to look into. It can be very vulnerable to change this up, and I want to acknowledge that. So if you're choosing this path forward and you're leaning in, you're choosing to speak up for what you need and explore your body in different ways. You're choosing to be more directive with a partner and ask for what you want and show them what you want or what works and what is on the table. That can feel very vulnerable. But we can learn a lot, and we can grow from leaning into that vulnerability. Again, as we're choosing this path forward, are we seeking out therapy? Are we seeking someone who is trained in sexual health and chronic illnesses like cancer? We're going to address our depression, our anxiety. We can use cognitive behavioral therapy to address any thought perceptions that maybe don't work for us anymore. And we can do some sexual counseling, either through just a regular sex therapist or even surrogate therapy. We might need to make some lifestyle changes, might need to look at nutrition and our general overall health. We might need to look at smoking cessation, alcohol intake. All of that can affect your physical, mental, and sexual well-being. We can look at medical interventions like aids and pumps, dilators, pelvic floor therapy, and or medications to help move things along. We can look at practical applications and adaptations. So we are going to address fatigue. We're going to address pain. We're going to address vaginal dryness. Again, there's lubes like Uberlube, very safe, has a good consistency to last a long time, doesn't have any of the gross stuff in it that we don't want to introduce to our bodies that could be irritating. A lot of the lubes that you would just buy at the regular grocery store might be a little bit more irritating for sensitive areas. We can look at functional adaptations like toys and aids. Again, really encourage you to find, the internet is a wonderful place to find stores, either online or in person, that are run and cater specifically to vulva owners, because they're going to have more tools that work well for vulva owners, and they can probably guide and have a discussion around what might work for your particular needs. Because I do acknowledge that some of these toys and aids can be very expensive, and we want to try to get something that is going to work without too much troubleshooting. And then, again, I want to address that, for a lot of people, this whole process means complete loss of fertility. There maybe wasn't a chance or a discussion around salvaging fertility. That may be a particular trauma and an area where people are stuck. So I want to make sure that we acknowledge this for people. It is best that your medical team address this prior to treatment. Sometimes that doesn't happen given the timeline or the aggressiveness of the cancer, and they move forward with treatment without having a full discussion around it. So I want to acknowledge that some people may be stuck in that they didn't get that full discussion until afterwards. And even if they did, that they still may be stuck here thinking about what they've lost, and that we need to grieve some of these losses, or a change in how we thought things might go, how we may have a family, or that we may not be able to have a family in the way that we wanted, if that is something that was on the plan. That is a real barrier for a lot of people, and it ties in with your sexual self, because we have this cross position where sex and fertility go together. But again, I want to recommend that we try to unknit some of that, and that we remember that sex is for pleasure. It is a great coping mechanism, and that your body deserves consenting, pleasurable physical touch. When we started this journey, we started with your perceptions of coping, because like it or not, your brain is your most important sex organ. So really important to get that right, and that you get all the support you need around this journey in helping you form your thoughts and feelings about where you've been, perhaps what you've lost, and where you want to go. We're going to end here with some considerations for the uncoupled. So this kind of looks like dating and cancer. We do know that people do better with more social support, and we also know that women tend to lose support in their cancer journey. So we don't have control over who steps up and how they step up. What we do have control over is our own mindset and how we respond. And we need to have value in different types of relationships. Another way that we can take control is to address the narrative and address the elephant in the room early. So if you're trying to engage with a new partner, bring it up early. Just dive right in. Who you are, what your journey's been, and how it has affected you, and what you need. What are you looking for? I encourage you to re-script any non-reciprocation. So maybe you're vibing with someone, at some point you bring up your cancer journey, your struggles, your needs, and at that point they decide that they are out. I want you to re-script this non-reciprocation as people taking care of themselves. You want people in your life that fit your life and that can handle every ounce of you. And so if you have been open and honest with them and they said, no, thank you, that's not for me, then please think about that as that person saying they're not willing or able to take up, and it's not a reflection of you, it's them giving you a gift. The gift of time and the ability to not have to deal with them being in your life and disappointing you. We want you to be prepared. So it might be helpful to get some scripts and templates for sticky conversations ahead of time. So if you need to end a relationship early, if you need to say something doesn't work for you, if you need to speak up, people always do better when they have the words to say. So think about these situations ahead of time. Talk to friends, talk about things that could come up, and make your script so that you have a great thing to text someone or to tell them in person. And again, touch is powerful. I really, really encourage that you identify ways to fulfill the need for pleasant and comforting touch. Skin hunger is a real thing. If you go back to the circles of sexuality and you look, that is one of the areas. And we can start there. If you want to start slow in this journey, if you want to build up from there, if you really need to lean in, just start with what is comforting touch. We may have learned through this journey to mistrust our bodies. We may feel betrayed. A lot of the touch and experiences that you experience through cancer treatment are not pleasant. And so we may need to be vulnerable to allowing pleasant and comforting touch. And we can start small and grow from there. I encourage you, if you have any questions, feel free to email me. My email and contact are below, and there's also my contacts on the first slide. Thank you for taking this journey with me today. I hope that some of the tools and things that I discussed are helpful. I hope that you're able to engage in them and to lean into some vulnerability, and that you're able to connect with a journey on what you want. There may be areas where you feel more stuck, and that is perfectly fine to bring in a one-on-one therapist who can help guide you through this and keep you accountable. Or if there are more physical needs, we can work with our medical teams, our pelvic floor or other physical therapists, or our sexological body workers to address these needs. There's a lot of tools out there. There's a lot of things that you can lean into. And I hope that you all get along on your journey to have a fulfilling and whole, consenting, and wonderful sexual selves. Thank you.